the sights of the Climate Commission and government. A new study finds driving a used electric car is cheaper in the long term than even a new petrol car. We'll also be talking to Fran Kewini, the creator of a play centred on personal stories illustrating the barriers Māori have to healthcare. Barrier Ninja is based on real-life recordings of doctors, patients and nurses speaking of inequity and the need to cut through red tape to get things done. Just before the news, our Pacific correspondent, Moira Tuilaipa-Taylor, will bring us up to speed on the New Zealand government's commitment to try to encourage Micronesian countries to stay in the Pacific Islands Forum. After the news at 10, it's never too late to grow old disgracefully, so says Sydney-based GP and novelist Joanna Nell. She writes stories that define people by their personality and spirit rather than their age. Her third novel, The Great Escape from Woodlands Nursing Home, is filled with characters who are young at heart. Around 22:11, Arahia Latham is here to share her favourite Māori books from 2020, and that hour will end with the reading today, The Blind Tank by Vivian Plum. In the final hour of the show, Grant Smithers is along and he's very excited about early punk New Zealand band The Plague reforming for next week's Punk It Up live shows in Auckland. Sports commentator Sam Ackerman's here around 11:30 to discuss the start of racing for the Prada Cup. Who should we be cheering for? And Lise Carrington being named the most influential Māori athlete of the last 30 years. Wrapping up the week for us today, Karen O'Leary and Pinky Agnew on their list. The mansion featured in the TV show Schitt's Creek is up for sale, and a warning for people who go to sleep listening to music through their AirPods. This is RNZ National. It's great to have your company this morning. It's now 9:08. The government agency charged with caring for vulnerable children is again at a major crossroads. Oranga Tamariki's chief executive, Grania Moss, resigned from her role last month after mounting criticism of the policy that allowed the uplift of newborn babies, predominantly Māori, into state care. The ministry was established nearly 3 years ago, replacing Child, Youth and Family, and promised to put the child at the centre of everything it does. It also promised more early intervention and targeted support for at-risk children, with more support for caregivers and better resourcing for social workers. But it's been the subject of several critical reports, particularly of its care of Māori children, who make up 59% of all children in care. The Minister for Children, Kelvin Davis, has said Grania Moss's departure is an opportunity for a better partnership with Māori. Zuwera Gardner is now acting chief executive, and an advisory board's been established which will report by June. Joining me now to discuss the future for Oranga Tamariki is Glenys Philip-Barbara, Assistant Māori Commissioner for Children. Kia ora, welcome.
Morena, kia ora.
Vaughan Milner, a registered social worker with 45 years' experience on the board of the Association of Social Workers. Kia ora, Vaughan.
Kia ora.
And also Chief Executive of Caring Families New Zealand, formerly known as Fostering Kids NZ, Linda Surtees. Kia ora, welcome, Linda.
Kia ora.
Glenys, I will start with you. The Office of the Children's Commissioner conducted its own review, one of several, of Oranga Tamariki. Remind us, please, what did it conclude?
Well, as Children's Commissioners, what we hold at the heart of all this is a fundamental belief that every child in New Zealand, regardless of their background, regardless of their circumstance, has the right to grow up connected, loved, supported and nurtured by a family or whānau. We believe that this is at the absolute heart of the idea that New Zealand ought to be the best place for every child to grow up in. So when we undertook our report, Te Kuku o Te Manawa, and we released it just last year, as you said, our findings were really focused on four key things. So we found that Māori are not well served by current systems, and we know that this has been a historical problem. We found that the statutory care and protection system continues to reproduce inequities for Pepe, Tamariki and Rangatahi Māori. We also found that there's a considerable lack of trust and lack of evidence of that trust being present in the community, that incremental change can actually deliver the results that New Zealanders are seeking for tamariki. And we do believe that now is the time to commit to a transfer of power and resources to a by Māori, for Māori approach. Everybody we've spoken with, all of the reviews that we've looked at, have all concluded that this is the only way forward to deliver results for tamariki Māori.
What were the report's findings on this child rescue model?
So What we found and what we've concluded is that the system has skewed more closely to a child rescue model and away from a family preservation type approach. And we understand that there are many factors that will be driving this. Principally, of course, we have concerns with caseload numbers for social workers within the system. We understand that in order to do our best work, where we have concerns about the safety and well-being of a child, social workers need time to engage with a whānau. And we know that a whānau, in the case of a tamaiti Māori, may be hundreds of people, and that within those hundreds of people there is absolutely likely to be somebody who can provide safety for a child while that whānau is undergoing their own processes of healing and restitution. But when we are skewed towards child rescue, what we find typically is that caseloads are high and social workers are short on time to do their best work.
The advisory board, what priorities would you like them to have?
Well, I have huge faith in this advisory board, actually. I mean, Dame Nader Glavish has been outspoken but also deeply involved within her own whānau hapu and iwi systems around the care and protection of tamariki. Matt Tukaki also has undertaken quite a broad and strong systemic and structural review of inequity for Māori. Sir Mark Solomon, his record speaks for itself, and of course Shannon Pakura, an experienced social worker. So between the four of them, I am very, very comfortable that they are across the issues that have been raised in our Te Kuku o Te Manawa report.
Given the findings of your report, given the findings of other reports, how much damage has been done, do you feel, to our vulnerable young people, Māori and non-Māori, over the last 3 years?
We know from talking with young people in the system and with talking with some of the whānau midwives and community workers as part of Te Kuku o Te Manawa, that the damage is intergenerational, so that people carry deep scars and trauma into their lives when these processes aren't conducted in accordance with the law. The legislation actually requires that in all but the most exceptional cases where an uplift decision is to be taken, whānau, hapu and iwi must be consulted. Parents must understand what's at stake and what's expected.
Linda Surtees, I'd like to bring you in here, Chief Executive of Caring Families New Zealand. You work with more than 5,000 active members caring for children around the country. What is your view of where Oranga Tamariki is now and needs to be?
I think that where it is now is probably just, it almost feels like another go around, really. So where it is right now, I think that the advisory board, I agree with Glenys, and I think that we all hold a lot of faith in the advisory board. It is very competent, very capable and highly skilled board to be able to look at what is happening in New Zealand. I think going forward, what I would like to see in my wish list would be community. So I think that more community involvement is needed to actually address the issues that are there for children in care, and from a caregiver perspective, that is of course all that we are focused on. We're all here for the same outcome. We all want all children in care to have better outcomes. I also would like to see us get ahead of the problem rather than constantly chasing it. So at the moment, I kind of feel like we need to be investing a lot more in keeping children from entering care in the first place, and working with whānau, both whānau prior to children needing to come into care, and also I'd like to acknowledge that while there's around about 6,000 children in the care of the Chief Executive, there's a further 18,000 children for whom the unsupported child's benefit is being paid. And so those are people who are in the care of other family members. It might be grandparents, it might be auntie, or they're in permanent care placements, and they need a lot more support than they are currently receiving.
What are the concerns you're hearing from your members?
You probably don't need your sticker, Ashley. I think everyone knows who you are. Feel free. Yeah.
Kia ora koutou katoa. Good morning. We've just come from a very useful meeting with a number of major New Zealand businesses and business representatives where we discussed the vaccine rollout in New Zealand and the work that we can do together to ensure our vaccination campaign is a success. As you all know, the vaccine is important for protecting our health, our economy, our current freedoms, and securing the gains that we've all collectively made to date. So there's a lot of support for ensuring that next stage of our measures around COVID-19 are a success. On that note, I have good news. This morning, I can confirm that New Zealand's first batch of the Pfizer-BioNTech COVID-19 vaccine is set to arrive in New Zealand next week, well within our scheduled timeframe and ahead of previous expectations. That means we should be in a position, all things going to plan, to start vaccinating our border workers from next Saturday, the 20th of February. I can confirm that officials in New Zealand have been working tirelessly behind the scenes to secure the timely arrival of these vaccines. And there has been regular contact with Pfizer over the last few weeks, and I want to thank them for their work. I also want to acknowledge and thank Pfizer for not only ensuring the delivery of the first instalment, but doing so earlier than originally anticipated when we entered into some of those agreements. Last year, we indicated the vaccine would arrive in Q2, and earlier this year, we updated that to Q1. So given all the pressures on global distribution, it's very pleasing to be receiving them at this stage in the quarter. Minister Hipkins, Minister Wood, Minister Little and Dr Bloomfield are all here and available to answer any questions that you might have. But before we open up, I do want to speak quickly to the sequencing from here, just as a reminder. Our first priority is our border workers, our first line of defence, who interact with returnees who may potentially have the virus every day. We expect to vaccinate these approximately 12,000 workers within a 2 to 3 week time frame. The next group to be vaccinated will be our border workers' household contacts, their family members or people they live with, as they have the highest chance of picking up the virus from the border workers they live with. Following this group will be healthcare and essential workers and those most at risk from COVID, such as the elderly or those with medical conditions that make them vulnerable if they get COVID. These people will be vaccinated through, we expect, Q2. Before vaccination of the wider population starts, we anticipate in the second half of the year. As I've said many times before, this will be New Zealand's largest ever vaccination campaign. Never before have we vaccinated our team of 5 million in such a short space of time. It is going to take all year to reach everyone, so the sequence and ordering is important. But be assured, we have pre-purchased enough vaccines to cover all New Zealanders and to do so for free, and the Pacific as well. And we are so lucky that we can run this campaign in a fashion that means we continue to protect every New Zealander without the experience of those life and death situations that so many other countries are experiencing. We're now happy and ready to take questions.
Is it the full 450 doses that you're expecting in the first batch?
No. Minister Hipkins, would you like to talk to the sequencing?
No. We've our advance purchase agreement has us getting around 250,000, just slightly under 250,000 in the first quarter. That is going to come in waves. So I've indicated previously that we're likely to get a near weekly delivery, and that our first quarter shipments will be split over those deliveries.
So how many will we get in the first week?
It's likely to be in the low tens of thousands that we would get in the first shipment.
And which day are they likely to arrive?
We're not in a position to be able to share that. We actually only take ownership of the vaccines once they arrive in our freezers and once they've been deposited in our freezers. Up to that point, it sits with Pfizer and with the company that they're using to transport them to New Zealand. And they have asked us not to share the specific information about how they're getting here or when they're getting here. We obviously have to respect that.
We understand that it will be by air. What can you tell us about the logistics of how they'll get from Pfizer to the arms of our
It's
border.
quite an exercise.
It is a significant exercise. Obviously, one of the key things for us is once they have been deposited in our freezers and we have taken ownership of them, we then have checks to do to make sure they've been kept at the right temperature all of the way through their journey, and that they are safe to use. And that'll take a couple of days to do that, which is why we have indicated that we're ready to go from Saturday, allowing us to, that couple of days. If they arrive earlier, then it just allows us a little bit more time to do that as well. But we need at least a couple of days to do all those checks, and that's why we've said we're confident from Saturday we're good to go, and so we're going to start preparing for that.
Minister, can you just clarify how many are arriving next week that we will start seeing rolled out on Saturday? Are you saying it's tens of thousands that will go daily for some time or weekly?
No, like I said, we're expecting the first shipment to be in the low tens of thousands, but over the coming weeks in the first quarter, we're expecting to receive, I think it's 226,000 by the end of March. Now they'll be split over several deliveries.
And when will the remaining 500,000?
So they'll be split over quarters 2 and 3 at this point. So our Pfizer delivery schedule has us receiving that 750,000 courses over the first 3 quarters of this year.
Keeping in mind it's 2 doses.
Yeah.
Will the first batch be enough to cover all of our border workers and their families?
It will certainly be enough to cover all of our border workers. I'm confident that we'll be able to cover their families in a timely manner. Bearing in mind, we're expecting to, once we start getting them, we're expecting to continue to get regular deliveries once we get underway.
And how many vaccines can our freezers hold?
I can't remember the exact number. We certainly have enough freezer space to hold the ones that we're expecting and the ones that we've already ordered, and we continue to look to expand that.
Can you just clarify, is that 226,000, is that doses or people, full courses?
That's courses that we're getting. Yeah.
And what does that look like in terms of distributing it from those freezers here and in the South Island? What's the plan around that?
So we have the bulk of our freezers are here in Auckland, and we also have freezers in Christchurch as well. So we will be sending some to Christchurch as soon as those freezers have been certified and ready to go. Once they come out of those freezers, they can be brought up to a higher temperature for up to 5 days. So that gives us the opportunity then to distribute. We would be looking at a quite tight distribution timetable though, so we wouldn't be sending out large numbers to the places that are going to be administering the vaccines. We'd be looking to send them out as they need them, so that we minimise as much as possible wastage.
And what is that
going
higher?
directly to MIQ facilities? Will you be designated doctors or clinics? What is the logistics of getting those workers?
So for our first rollout, which is obviously a reasonably controlled and smaller workforce, we'll have dedicated teams going in, as we do with testing, going and delivering those to the border workers in their workplace. That's the first part of the strategy. As we start to open up to a bigger group, for example, their family members, we will be asking their family members to come to a particular location, and it won't necessarily be the workplace of their loved one, because in some cases we don't want extra people going to those workplaces like MIQ. We want to keep the minimum number of people in them that we can, but we'll be nominating a place where we'll be asking them, please bring your family to this place for their vaccine.
Just for context, so everyone is obviously aware that the freezers we're using are keeping their temperatures at below 70 degrees Celsius. For that 5-day period where you're able to bring it up, my recollection is it's 2 to 8 degrees,
yeah,
so
which
it's
is the
still
normal cold chain.
So it is still requiring that cold chain of supply, and we do need to make sure that we maintain that all the way through the process, just to give you a sense of the logistics.
And has each vaccine had to be broken down into 4 or 5 doses?
Yes.
Yeah.
Yep.
Is there any particular training or anything going on?
Yes. Go ahead, Minister.
Thank you, and kia ora koutou. So, yes, there is some additional logistics around the administration of this vaccine, because it comes in vials that contain, which were initially 5, but now can have up to 6 doses. And there's a separate diluent that has to be added to that vial, mixed, and then the dose is drawn out very carefully. This is different from all our other existing vaccines. So all our vaccinators, even though they are trained, need to do a specific training module for this vaccine, which is actually a 2-hour online training module, and the first 100 of those vaccinators are already undertaking that training now.
Why is there the secrecy about the delivery of the vaccine?
Look, I'm not sure I would characterise it in that way. But ultimately, we're able to give you a sense of when we expect generally that they'll arrive. The drug company themselves, though, they're still the ones responsible for its delivery into New Zealand. They want to keep that specific information around when precisely it's arriving and on which flight it will be arriving to themselves. And look, there'll be a number of reasons for that, not least, of course, there are a number of variables that they'll be having to manage. And so if they give too much specificity, of course, there's a question sometimes of whether those details might change. And I imagine there's an element of security around it as well.
What happens if someone refuses a vaccine, if a border worker or their family member refuses the vaccine?
Of course, at the moment, our messaging strongly to all New Zealanders is that this is a way that you can play your part to keep yourself, your family and your colleagues safe. No one understands that better than our border workers, so we're getting a strong sense that there's a real eagerness to protect themselves and their family members. I expect that therefore we'll have very good uptake. What we're working through with our team members and workers at the border is if they are reluctant or unwilling to be vaccinated, whether or not we need to consider where in the system they are working so we can minimise their risk.
They could lose their current job?
No, that is not what I'm saying. No, it's a question of whether or not they would remain in positions that put them at the front line and then put them in a risky position. Those are issues we're working through. I don't anticipate that being a large issue. These workers, they absolutely understand how important it is to keep themselves and their family members safe. We'll be doing as much as we can to support them in this early vaccination process, and I imagine we'll have good uptake.
What about those workers or their family members who are pregnant? At the moment, the advice is speak with their GPs.
Yeah, and look, you know, for a number of reasons, I imagine that those will be conversations that already would have happened around whether or not someone's working at the front line whilst pregnant, interacting with COVID-19. So I imagine often those conversations will have already been had prior to a vaccine becoming available. It is, of course, considered safe for those who are breastfeeding. For pregnant individuals, it is a conversation between those who they have a medical relationship with, their doctors and GPs.
Why would they need a conversation with their GP? Who would it be suitable for or not suitable for?
And that's actually, look, let me get Dr. Bloomfield to speak to that. The advice from MedSafe has been that it's not that they've not said, for instance, that pregnant women shouldn't have the vaccine, but they have essentially turned that over to medical professionals.
Yes. Thanks, Prime Minister. Yes, the key issue here is that none of the trials for this vaccine have included pregnant women, but as the PM said, the safety data doesn't suggest there would be a risk for pregnant women, so with good information, some women may choose to be vaccinated, others may choose not to be.
What's the ongoing discussion with other pharmaceutical companies about getting the other vaccines here? Where are we at?
Of course, within our advanced purchase arrangements, we have general indications around delivery timetables, and we've had nothing to suggest that any of those have changed. The next most important step, though, of course, is MedSafe approval for those additional vaccines. MedSafe are in the process of now receiving information that they need to start that process with AstraZeneca. But as I say, nothing otherwise to suggest those general quarterly timeframes have changed.
And how big a sort of event is this when it comes to keeping our country safe?
This is a really important milestone, but it's just that, one of many that we'll have over the course of this year. This will be a significant ongoing campaign, but there's no question that it's fantastic to reach a point where we can add that extra layer of safety for our frontline workers who do an incredible job on behalf of all of us. Okay.
Can I just ask a question about Air New Zealand, Minister?
Yep.
What's your view on Air New Zealand taking down their information so quickly on the gas turbine work they were doing?
Oh, look, that would be ultimately a question for them. You will have already heard my view on the work they were undertaking with contracts offshore for other military forces, and I maintain that view. Now, though, obviously agencies are looking into whether or not anything more formal in terms of our regulatory framework has been breached.
Do you trust the airline though to investigate itself?
Well, it's brought in, as I understand, PwC to undertake some work on their behalf, but actually we don't necessarily need to rely solely on that. There is already work being undertaken by government agencies as to whether or not Air New Zealand have upheld New Zealand's legal obligations.
Would you support the Green Party's calls for the Foreign Affairs Select Committee to investigate?
I personally wouldn't see that as necessary because the Ministry of Foreign Affairs and Trade are already looking into the issue in conjunction with Customs.
And the outcome of those investigations by NFAT and others, would the government then look at a higher level inquiry?
I don't want to necessarily preempt that because, the outcome of that should answer a number of questions. And of course, keeping in mind, the Select Committee always has the ability to question, as they did last week, the leadership of Air New Zealand.
Did you see Anna Lorke's speech in the House, and what did you think of it?
I haven't seen it.
Has anyone spoken
I have,
to
of
her
course,
about
I
it?
was present for Anna Lorke's maiden speech. And as I understand, there has been the issue of a notice to the National Party for editing together speeches in such a way that leads to a misleading outcome. And so that's ultimately a decision for the Speaker in Parliament.
Has anyone spoken to her about it?
I couldn't answer that question necessarily at this stage. I certainly haven't. But do keep in mind that a ruling has been made that there has been editing that is being undertaken here that's led to a misleading outcome.
Just a question for Chris Wilkins about Air New Zealand aircrew returning
Yep.
from high-risk
Yeah,
countries.
go ahead.
Would you expect Air New Zealand to notify officials where those crew are staying?
Our officials have been working very closely with Air New Zealand around all of their arrangements for keeping their air crew safe. Obviously, we recognise, as Air New Zealand recognise, that those who are flying internationally are at greater risk of coming into contact with COVID-19. So we've been working very closely with them to constantly be refining what they're doing, including issues like exercise, making sure that these people are being well cared for. It's a tough job at the moment, and we need them to keep flying. So we're working really closely with them to make sure that they can keep flying and that we can keep them safe in the process.
So do you expect to know where they're staying?
We have been talking to them about where they are staying. We've also been talking to them about the extra protections that can be put in place in those places where they're staying, including things like putting exercise equipment into empty rooms so that they don't have to leave the hotels in order to exercise. They can stay in the same place.
Sorry, just to clarify, so you do expect to know where they are staying?
We've certainly been in conversations with them about where they are putting people up.
Minister, just with regards to the use of nebulisers in MIQ, we understand that the Ministry of Health is okay with it, but they have been linked to an outbreak in Melbourne, we understand. What's your thinking on that?
I'll ask the Director General to comment on that, but just overall, we're always looking at where the risk factors are in our MIQ facilities. We're always making changes. We will have more to say about the Pullman in particular in the next day or two, as we've been doing a very thorough investigation there around how we can improve that facility so that it can be reopened, and we'll have more information on that very, very shortly, indicating what changes are being made and when it will be reopening. But I'll ask the Director General to comment on nebulisers in particular.
Thanks, Minister. Yes, I talked with my Chief Science Advisor, Dr. Ian Town, on this just last night. The situation in Australia was an interesting one where the person didn't consider the use of the nebuliser as medical equipment and so was doing that in their room, and the people in charge of the facility weren't aware. Here we have, because of the way a nebuliser works, someone who would be needing and using a nebuliser would be being cared for in one of our quarantine facilities with a higher degree of clinical and health support anyway, and any staff or having interactions would be using the appropriate PPE like N95s, but we will be going and having a specific look at that issue again.
Look,
In terms of the vaccine rollout in
Yeah.
the Pacific, because the vaccines are coming ahead of time, are we looking at an earlier distribution push out in the Pacific, or what would that distribution process look like?
A good question. We're actually proactively having this discussion at the moment. One of the issues that we've been having to contend with is simply how do we overcome the distribution issues that Pfizer particularly presents. And as you've heard, specific equipment needed for transportation, very limited time frame, they can be outside of that equipment. And so these are things that we are actively working through. So we'll be looking to really have conversations with our counterparts in the Pacific around what might be possible with some of those trickier vaccines so that we can see similar levels of protection provided in the Pacific at the same time as we might be seeing that in New Zealand. Just one final note. Oh, you can have the last question, then I'll just do a wrap.
In terms of MIQ cleaners, is it fair that they're not getting paid any more than what they had been prior to those facilities being used as MIQ facilities, given they're now at great risk?
And look, I'm simply unfortunately not familiar with the contractual arrangements for those individual workers. But what I will say is I'm strongly of the view that those workers in particular need to be at the front of our queue for vaccines. We need to change the mindset in New Zealand about a workforce that is doing us a service. We need to demonstrate how important their job has been to us, and I'd like to see that kind of acknowledgement at all levels.
Sorry, one quick question from an Australian colleague. What is the
That does not help your case.
She's a Kiwi. For the Trans-Tasman bubble?
Well, as it was reflected on a number of times, unfortunately we don't have enough data yet for vaccine having an impact necessarily at this stage on transmission. So we just can't say for sure that if you're vaccinated, you're not at risk of passing on COVID-19 to others. That will be a significant step change if we see that evidence and data emerge. And I'm sure that will make a difference for travel to all parts of the world. So at this stage, it won't necessarily make a difference there.
So it won't change the MIQ rules at all? for people coming
Not at this stage, but we keep a very open mind as the research and the data continues to present itself. I did say I'd wrap. The Minister has a flight. The last final comment I want to make is that behind this program is an extraordinary amount of work that has gone in, particularly by the Ministry of Health. They have completed multiple walkthroughs now of what this initial vaccine rollout will look like, the logistics behind it, making sure that we have the technological platforms to deliver a year-long campaign. I want to acknowledge the long hours and hard work that's been put in alongside our ongoing regime around protections against COVID-19. So just my thanks to the team who've been working on it. Thanks, everyone.